Vision, strabismus, and cranial movements. Holly, to answer your question, first of all, there are cranial groups, but you have to do the cranial courses to get in those groups. Second of all, the answer is yes, that the cranial movements can help with strabismus. However, you still need to know what's going on, and I have no eye report. You cannot do anything like that without a retinoscopy, because to be working on cranial movements without looking at, does a person need glasses, you know what I mean? So that's where, too, I need the whole picture. People can write me all day long, MRI, EEG, blah, blah, blah. I need a video. I'm a visual person. I need a video of what's going on. But to answer your question as a whole, cranial movements with vision are really important because of the cranial movements. Now, again, I can write an encyclopedia alone on something like this. And let's go to the baby doll, right, and the cranial. So when you're dealing with cranial movements, right, all your developmental movement patterns are meant to happen prior to the cranial fusions. Now, a lot of people, again, think of the anterior and posterior fontanelle or the soft spots, right? But if you look at this, all the sutures are engaged in a form of subluxation. It's not truly subluxation because it's not like it's dislocated, but they're not fused either. They have that room. And a lot of people don't even realize that we have two bones in our forehead which will eventually fuse. But again, the coming to sitting through the back, right, on all of this is where the brain almost reminds me of like a ladybug taking flight. From the first moments of birth, the parietal bones engage simultaneously to engage the spinal column to bring out the baby from the womb, right? And when this is interrupted, where they stop it maybe and take a nuchal cord, even though the cord hasn't created any kind of oxygen deprivation, right? Just the hold that somebody might have on cranial with your child can cause issues, right? And this is where I'm trying to show a lot of these baby videos lately, the way they manhandle, like just holding the baby from back here, like, what are you doing? But again, parents aren't taught this either. You know, it's not that it's ginger, but that just, if everybody in the world just learned the water bowl technique and really how to hold a baby, what a difference, you know, that their movements can make. Now, again, with this, do we have any kind of jaundice? The jaundice now has an engagement of a whole eye shield plus cranial straps that go up above and onto the side. Well, my gosh, you know, that's like a pre-autism cocktail with that. Forget, you know, having issues with crossing visual midline because of just jaundice. Now, I'm not saying don't do phototherapy. We have to save the baby. But if you're not, you know, used to be that they're just taping gauze to the eyes, but now they do this whole big, it looks like from the movie Ready Player One kind of video ensemble and positioning. This really could be detrimental to child development. But again, nobody's looking at the big picture like I am. And this is where I come into play. And hopefully more people like me start opening their eyes, saying we can't keep messing up the babies. So you are correct saying that you want that movement there. Even if you need glasses, you put the glasses on. First of all, we have to integrate the glasses. I teach that in training. Glasses on, glasses off, glasses, you know, because just the weight of the glasses being inanimate objects will lock up the vision and lock up the spinal movements as well as all the movements in the rest of the body. And again, it's not saying don't use glasses, is that they have to be integrated. The one thing I will say don't use, guys, is like one of those watches to go with your phones. Like, get them off your bodies. You're going to blow your backs out. But that's another story. So when you're coming up to sitting, again, that temporal bone needs to rock. This little bone here, this what helps you get into sitting. And so again, when there's cranial interruptions with the movements and so forth, especially if there's eyeglasses going across the temporal bone, yes, this is going to cause you know, more, I wouldn't say complications, but it's anything that you do to the body is a deviation in movement, whether it's a progressive or regressive. But I don't want, you know, reactive parenting. I want proactive. And so your conversation is right. So, but even though we're, let's say, Patchen got the glasses on, the astigmatism is starting to correcting, the balance of movements through all these cranial bones have been affected due to the astigmatism. So you are correct, but will that prevent the surgery per se or the correction? again, for anybody that's looking at surgery and doesn't know where their acuity is at, you need a new doctor. Surgery I don't have a problem with, but I have a problem with if it's just because a child needs glasses and they're not dealing with the glasses part, because the eye could be turning in just trying to focus. So you need more information, but so does the parent, because if the parent had more information, that means you would have it. And I hope that helps. Thanks.